Thank you so much, Sushmita, for the excellent presentation on the ROI tool and all of the research. And I must say, on behalf of UNFPA, really thank you to all the team at GBL who's been involved in this project with us, because it's great to see the tool come to life at the end of all our work. And thanks everyone for listening and joining the webinar today. So before I start the presentation on the ROI tool and really the vision behind the tool, I'll start by introducing myself first, and then my organization, the organization I work for. So my name is Federica Maurizio, and I am working at UNFPA as a sexual reproductive health data specialist. And I've been involved in the management of the program that created the ROI tool, which is a program called Workplace Access to SRHR. And UNFPA, probably many of you on the call might not know us, but UNFPA is the United Nations Population Fund. And we really are the United Nations Reproductive Health and Rights Agency. So the mandate of UNFPA can really be summarized with what you're seeing now on the screen and what we call the 3 zeros, because UNFPA works to get to 0 preventable maternal deaths, get to 0 unmet need for family planning, and get to 0 gender-based violence and harmful practices. So the core of the mandate of UNFPA is really around ensuring rights and choices for all, and realizing sexual reproductive health and rights everyone. And UNFPA works in over 150 countries worldwide. And in particular, in the Asia Pacific region, we work with 22 countries in Asia and 14 in the Pacific. And you might be thinking now, how do we link the mandate of UNFPA into our program, into business outcomes and business and worker well-being? And I think the key link here is that we saw at UNFPA the opportunity to involve the private sector and businesses to make sure that they can really be agents of change, to ensure that their workers, their employees, and women employees in particular, have the means to realize their sexual reproductive health and rights. And businesses really have the opportunity and the power to provide choices and opportunities to their employee to overcome some of the barriers that workers might face in accessing crucial health services. And this is because we need to think of the demographic, I would say, of the manufacturing workforce in Asia in particular. And if we think about it, in many countries, a lot of women are employed in the manufacturing industries, particularly in the textile and garment industry. And often these women are young and might be migrants, because they might have moved to the city to go work in the factory, or they might even have moved from neighboring countries. So we see how the employees might have might face a real struggle to access sexual and reproductive health services, especially if they're involved in the factory during the day and might not get the chance to go to the clinic. So really, we saw at UNFPA the opportunity to partner with businesses to make sure that there was a way to overcome the barriers for employees. And really, this is how the idea of the ROI tool was born. So the ROI tool is what it says there on the title: investing in workers' well-being. When we started the project, even before partnering with GBL in this phase of the project, UNFPA had developed with some partners a very basic prototype version, even more prototype than the prototype that Sushmita showed you earlier. And this earlier version of the ROI tool looked in particular at contraception. So providing contraception to workers to ensure that they could plan their pregnancies and to reduce the number of unintended pregnancies that might happen in the workforce. And the tool started to be utilized in some of our partner countries, in particular in the Philippines. And we saw how it created a lot of interest in the private sector. So we decided to expand on the ROI tool. And in the second phase of the project, which is the one where we got into a partnership with GBL, the ROI Tool project, which was supported by the United Nations Foundation in their Universal Access progress, and also by Merck for Mothers. The second phase of the ROI Tool really saw us use qualitative research methods, as described by Sushmita, to make an expanded version of the ROI Tool, to move beyond family planning only and to include all of those interventions that you've seen on our slides. So to make it really as comprehensive as possible in terms of sexual reproductive health interventions. And the key message of the tool is that showing the possibility for businesses to improve their workers' health and well-being means that workers might have better access to sexual reproductive health services, might become healthier in return, and can be more empowered and make better decisions and have more decision-making power in their personal and professional life. So the tool advocates for a more productive and empowered workforce. But at the same time, it can show, and that's what the business outcomes part of the tool is all about, it can show to businesses and private sector companies that investing in workers' health and well-being can have a return on their investment, a return in terms of increased productivity, reduced absenteeism, and reduced staff turnover. So really, it's a win-win for everyone. And we want to show that improving access to services for the workforce also creates economic returns for the businesses. So what's next for ROIT? You've heard Sushmita presented very comprehensively, and I think Rochak has put the link in the chat for you to go and explore yourself on our website. But so the tool has been just recently finalized, and what we really want to use the tool now for is to really strengthen the business case for private sector investments in workers' health and well-being. And I think one of the points mentioned by Sushmita earlier is that when GBL helped us do the systematic literature review, we realized that there wasn't a lot of purely peer-reviewed or academic literature related to this link between health interventions and economic and business returns. So that was definitely a challenge for us in the development of the tool, but it also shows how we really need to move into creating more evidence around the business case for private investments into workers' well-being. So the next phase for ROIT at the moment is to, first of all, partner with companies, for example, like Shahi, who's here on the call with us, to really see if we can use the tool to make the projections first, see what the tool says in terms of the business outcomes, and then implement the interventions as suggested and measure the impact. So it really shows that there will be opportunities for using monitoring and evaluation frameworks or conducting implementation research to validate the projections that the ROI tool makes, and also to continue building the evidence base for this sort of work, because we know that companies are supportive of workers' well-being program, and they are supportive of fulfilling their corporate social responsibility commitments. But they also need to have evidence that this works, and this is a positive win-win for everyone. So that's what's next for us, UNFPA, and we really look forward to continuing this path that we've started with ROIT. This really leads me to the last slide for my presentation, is to talk about the importance of evidence generation and research in program development. And of course, speaking from the perspective of a UN agency, we really want to make sure that all of our programming, whether it's in development context, whether it's in humanitarian context and responses, all of our programs need to be evidence-based and need to have sound research at the heart, which makes us sure that what we're doing has a positive impact. And of course, this can be done like we presented today with the ROI tool to the workplace access to SRHR program is one example, but we really want to focus on all aspects. In the case of UNFPA, it's our mandate, it's midwifery, it's maternal health, or it's even financing for sexual reproductive health, making the economic case for investing in these services. So the opportunities for collaborating with research partners like GBL, it's really critical to our job. And we look forward to having more opportunities to test the ROI tool in particular, but also all of our other programs. So thank you, and we'll look forward to the discussion at the end. Thank you so much.